Hello everyone, I'm Tianga Thalagala. I'm a senior lecturer in the Department of Statistics, Faculty of Applied Sciences, University of Sri Lanka, Sri Lanka. Imagine a city or a country preparing for its annual battle against dengue season. This involves community cleanups, awareness campaigns, and vector control programs. Then suddenly the world shuts down due to COVID-19. Hospitals are overwhelmed, mobility is restricted, and public health priorities shift almost overnight. But mosquitoes didn't lock down. What happens to disease dynamic when two public health crises collide? In this presentation, I will walk you through how we addressed one of the major challenges in dengue forecasting, the interruption caused by the COVID-19 pandemic. Before proceed, I would like to ask a question. Mosquitoes or snakes? Which scares you more? I'm pretty sure for most of you, the answer is snakes. But according to statistics, mosquitoes are more dangerous than snakes in terms of the number of human deaths they cause each year. Mosquitoes do not kill humans directly. Rather, they are a vector that transmits mosquito-borne diseases. One of the critical mosquito-borne diseases is dengue. This plot presents the countries most affected by dengue according to 2019 annual data. Most high-risk countries are located around the equator. Countries near the equator are at a high risk of dengue due to several environmental and biological factors that favor the survival and spread of Aedes mosquito, the primary vector of dengue virus. These regions often experience temperature between 25 and 30 Celsius, a high humidity, and regular rainfall, creating ideal breeding grounds for mosquitoes. Further, mosquito eggs hatch more easily in moist environments. For most of these countries, there is no severe winter season, eliminate mosquito populations temporarily. In this talk, I use data corresponds to Sri Lanka. Sri Lanka is an island in the Indian Ocean. This plot shows the time series plot of weekly dengue cases from 2007 to 2025. And here you can see a big peak. In 2017, Sri Lanka experienced experienced a significant dengue outbreak, primarily caused by a new genotype. And the next one is here, the sudden drop in dengue cases during the COVID-19 pandemic period. This could be due to several reasons. Misclassification of dengue as COVID-19 or 19 or vice versa, since early symptoms overlap. Early symptoms are fever, headache, and fatigue. Underreported or delayed reporting dengue cases due to lockdowns, travel restrictions, and curfews significantly limited people's exposure to mosquitoes. With fewer people outdoor and in public spaces, mosquito-human contact decrease, reducing transmission. School and workplace closure, they are common sites for dengue, daytime mosquito bites. Furthermore, international and domestic travel restrictions help prevent the spread of dengue to new areas and reduce imported cases. This period is referred to as interrupted period, as dengue cases did not follow the usual seasonal and annual pattern, largely due to the impact of COVID-19 related restrictions and behavioral changes. Here we look at how to forecast dengue cases addressing the interrupted effect from COVID-19. We'll explore how traditional models were impacted and how patterns shifted, what methods can help us forecast more accurately where disruptions are new normal. For this, I use weekly dengue cases corresponds to districts or 25 districts in Sri Lanka. This map shows the district boundaries. you can access to the data through the epidemiology unit functioning under the Ministry of Health. They publish weekly epidemiological reports. Using the Dengue Data Hub package, which was developed by myself, I have the functions to convert these weekly epidemiological reports into a tidy format. This project is funded under our consortium ISE 2022 grant, and you can access annual dengue counts for more than 100 countries through this package, as well as weekly trends and imported cases reported for several regions across the globe. This serves as a centralized repository for dengue-related data from around the world. You can get more information about the project on the project website, denguedatahub.netlify.app. I presented the work at the Our Medicine Conference 2023, and I received lots of comments to improve the Dengue Data Hub project, and I take the moment to appreciate that one as it improves the sustainability of my Dengue Data Hub project. Now let's look at the methods that I use to address the interrupted period. I use 3 methods, and also these methods are compared against the benchmark approach, which include without considering the interrupted effect. The first approach that so these are the packages that I use for data analysis. Dengue Data Hub is the package that I use to access the data, and the other packages that I use for data pre-processing and model fitting, I mainly use tidyverse package and tidywords packages that are specifically designed for handling time series data. So this is my data set. You can see the data includes data from week 51, 2026 to week number 9, 2025. First, I split the data into training and test set. Training data set includes data from 2006 to 2024. And 2025 data I use for test set. And this set includes a data corresponds to 9 weeks for each district. The first approach is with a benchmark approach. In this case, this is the situation where I fit models without considering the interrupted effect. So that means I use full training data set and fit ARIMA models to each and every district and then generate the forecast for 2025 period. Next, I'm going to talk about the methods that I use to handle the interrupted effect. First one is exclude the interrupted effect. So that means my training data set includes data from 2023 week number 1 to 2024 or week number 52 only. So that means I use only the post-COVID period as my training data set. Again, after that, by using that training data set, I fitted ARIMA models to each and every district. Second approach is, what I did was, first, I forecast the interrupted period based on the data up until 2019. Then based on that, I first identify the ARIMA models and then generate the forecast for the interrupted period. After that, I replace the interrupted period with the new forecast. And then that updated time series is used to fit the new models. And again, I fitted ARIMA models to using the updated training data set. So by using these 3 approaches, benchmark, approach 1 and approach 2, I generated forecast. Then the third approach that I use is the down-weighting interrupted period. Even though this is conceptually easy, this requires more work than other methods. Ideally, here what we will need to do is we want to give high weights to the uninterrupted periods, and we want to assign low weights to the interrupted period data points. So technically, it is very difficult to do, and there is no package to do that. So simply in this case, what I did was I generated forecast excluding the interrupted period, and also I generated forecast including the interrupted period without estimating it. And I assign high weights for the forecast that are generated based on the excluded period, and low weights for the period and for the forecast generated based on the interrupted period, and generate the combination forecast. That I called as the downweighting interrupted period. Then I compared the forecasting accuracy using all of these methods. And here the mean absolute scaled value and mean absolute percentage error generates infinite and NA values. The reason is some dengue cases contain 0 values, hence infinite and NaN leads to denominator goes to 0. And also specifically for mean absolute scale error, there are some constant values. That's why the constant values are related to the consecutive weekly periods. That's why we get NaN values. So I use mean error, root mean squared error, and mean absolute error to compare the forecasting accuracy. So this shows the distribution of root mean squared error across 4 approaches. So these are the points that denotes a root mean squared value corresponds to each and every district. And you can see for the benchmark approach, that means without considering the interrupted effect and updated COVID-19 cases, that means forecast the COVID-19 cases first and then use the forecast the COVID-19 period first and then use the updated training set. For those 2 categories, we can see some extreme cases. If we look at the summary statistics corresponds to root mean squared error, we can see overall downweight approach and excluded period gives a low give high accuracy compared the benchmark approach, that means ignoring the interrupted effect, and updated COVID-19 effect, that means first forecast the COVID-19 period and then use the updated training set. We get the same idea by if we compare the things using mean absolute error. Mean absolute error give us an idea about how large the errors are. And also we get the similar results when we compare it with respect to mean error, which gives us an idea about whether the predictions, whether the forecasts tend to be too high or too low. All of these accuracy measures suggest in overall, in general, downweight approach and as well as the excluded approach gives high forecasting accuracy. Then what I did was I go into the district and I explore which approach generates the best forecast for each and every district. You can see the results here. So you can see a green color represents benchmark approach. That means ignoring the interrupted effect, generate the best forecast. Orange color denotes downweight approach, gives the best forecast for those districts. And purple color denotes excluded period. We use only the post-COVID period data to generate the forecast. And updated pink color, magenta color represents when we update the COVID-19 period and generate the forecast. Those approach work well for the district shown in the magenta color. And also, furthermore, I explore why we see this pattern. And what I noticed was there's a close resemblance with the dengue weather zones in Sri Lanka. So for example, if you look at the plot here, most of the regions are with respect to excluded approach. And here we can see these areas are mostly affected by the first intermonsoon period. And here we can see another cluster And you can see this area is affected by the southwest monsoon period, which prevails from May to September. And again, we can see another cluster here that's again related to second intermonsoon period, October and December. So you can see basically these two creates one cluster and this one creates one cluster. So this indicates that weather has some impact on the best approach approach that we should be selected. This makes sense because the dengue cases has a close connection with the weather data. Next, what I did was I took one example from each case, and let's look at this district. This is the Colombo district, which is where we have the capital of the country, and it is a very Colombo has the highest population density. It reports highest number of dengue cases as well as the COVID-19 cases. And for Colombo district, it picks up the best model as the downweight model. So that indicates keep the data, but assign less influence for the keep the data, but it has less influence on the new forecast. This indicates there was an abnormal behavior during this period, but it returns to the same but it retains some signal, even though, so it says don't completely ignore this period, assign some down weight for this one. That indicates still we have the same signal going here. Next, I took another example from the excluded as the best approach. I use this district, the Gampaha district. Gampaha district picked up excluded as the best approach. That means it indicates now Gampaha district move to a new normal because we don't consider this part of the data in the generate forecast. In that case, we don't consider this part to forecast the data. We only use 2022 and 2023 period. So that means Gampaha shifted to a new normal of dengue cases after the post-COVID-19. Next, I select a district that corresponds to the benchmark as the first approach. I select this district, that is Nuwara district, and it says neglect the effect from interrupted effect and just use the usual procedure to forecast. Just use the data as it is and generates the forecast for 2025. It gives the best forecast. This makes sense. So for that means interrupted period does not break the pattern in the dengue cases. This could be true because this Nuwara district is a very cold area and it's a hill country, and we don't observe much dengue cases in this area, as well as not many COVID-19 cases. So this says it's safe to generate the best forecast are given when the interrupted period is ignored. And the other one is Anuradhapura district. For that means that here, this one here. So it says the best forecast are generated when you first forecast the COVID-19 period and then update the forecast and then I use the updated data set as the training, then it will give the forecast. Here, this Anuradhapura district is a tourism area, hence lockdowns and travel restrictions and curfew significantly limited people exposure to mosquitoes during the COVID-19 period. This indicates during the COVID-19 period, this normal behavior changes, but it again takes the usual behavior after the COVID-19 period. That's why it says first forecast the interrupted period and then use the updated data sets for forecasting. Further, I wanted to explore the reasons behind that. I use feature-based representation to explore. For each district, I computed the strength of trend and strength of seasonality of the time series. And here the corresponding data visualized here. Each plot corresponds to a district, and I color the data points according to the best approach. I also checked this for another two features, linearity and curvature of the time series data, but I could not see any relationship between the features of the between these time series features as well as the best approach. So the final conclusion, no single method performed best across all districts. The effectiveness of each approach depends not only the model architecture, but also on the nature of the interruption and historical patterns unique to each district. Beyond improving model performance, this can provide insight into stability and nature of the time series signal. For example, if it is excluded, if it speaks exclude as the best approach, that means those districts shift to a new normal. If we say downweight, that means still during the COVID-19 period also we observe that still that signal is there, but assign low weight for that. Updated COVID-19 period means even after the COVID-19 period, those districts continues the same pattern that we observe even before the COVID-19 period. Benchmark, that means for those districts, interrupted effect did not influence. The slides are reproducible. You can find the slides on my GitHub repository, and this is the link to the GitHub repository. And most of the ideas on this, most of the research idea for this project is influenced by this paper, Forecasting Interrupted Time Series by Rob J. Hyman and Rosman Barman. Thank you.
So thank you, and thank you for being here in the middle of the night. I was incredibly impressed with that. Unfortunately, our next session already has begun, so people are going to have to head to the next session. But I wanted to say again, thank you. This is an incredibly hard and incredibly important task. So thank you for showing us your work. I look forward to looking at it when I have more than 15 seconds left. So
okay, thank you very
again,
much.
thank you. Wonderful work.
Thank you.